It's my pleasure to introduce Noah Robinson. He's been a driving force in this arena, and one of the reasons I'm excited to be introducing him, it's not just because of the magnitude and importance of what he's working on, but he has ignored me completely. And I think it's to our better results. I had cautioned Noah that starting a company at the same time you're trying to work on your doctoral dissertation is not a good idea. I made that mistake, but he's ignored my advice. He's continued to push forward, and I'm so glad that you have, Noah.
Thank you.
And I'm going to make you describe your background and what you're up to also.
Yes. And I'd like to introduce Jewel, who has joined Innerworld. She's a co-founder of Innerworld, and we're so excited to have her here. And she's going to tell a little bit more about her background and her amazing work over the past 21 years working in the mental health field. And then we'll get into a little bit about Innerworld and some of the data and wrap up with a Q&A. Jewel, I will turn it over to you.
Hi, everybody. Thanks, Bob, for having us. Most of you probably know me as a musician. Few of you might know that I've been working in the mental health space for about 22 years now, but my mental health journey started long before that because I moved out of the house when I was 15. It's a very young age to move out, and I knew that statistically, kids like me end up repeating the cycle. And so I wouldn't let myself move out on my own unless I thought there was a reasonable chance that I might have a different outcome. So as I started to ponder this, I really looked at the fact that I had a genetic inheritance, and I knew that it could give me a predisposition to something like diabetes or heart disease. But I realized also I had an emotional inheritance, and I could see it trace back through the generations of my family. And it gave me a predisposition to addiction and abuse and a whole host of other things that really weren't that pleasant. So I realized what I needed to do was learn a new emotional language, a new way of relating to the world. But there was no school for this. And I realized that if I didn't learn something new, I would rely on what was familiar, which again, wasn't the preferred outcome for myself. It really bothered me that for kids like me, moving out at 15, no resources, no ability to get traditional resources like therapy, what happened to kids like me? You know, misery is an equal opportunist. It doesn't care if you're Black or white or rich or poor or young or old, if it is in your family systems as well as other contributing factors. But what if you want to learn a new way of behaving? That takes education, and education in our country costs money. And that was unacceptable to me. What about kids like me? Is happiness a learnable skill? Was it a teachable skill? So that's what I set out to learn on my life. It set me off on quite a journey and caused me to develop a lot of skills and behaviors that really helped me, behavioral tools. So when I was about, mid-20s, I wanted to see if I could help other kids that were in my situation, complex trauma, PTSD, anxiety, depression, etc. And could we help them in a non-traditional setting using peer-to-peer groups and using skills like behavioral tools? Over the 21 years, we've had incredible outcomes. And so as VR started to develop, I naturally looked at if I could scale a peer-to-peer system like my foundation. So when I was doing my due diligence, I found a young gentleman who was doing already 4 years of clinical research on the exact same model, peer-to-peer with scientifically proven tools like CBT and DBT. So that is how I met Noah, and I'm very excited with what's happening right now, and I think you guys will enjoy it too. I'll give it over to Noah.
Thanks, Jewel. Yeah, it was amazing to meet, and we're really excited to be working together. So I'll give a little bit of my background as well. So when I was 13, I basically escaped into a virtual world. I realized I was gay and became depressed, and started spending thousands of hours in RuneScape, which was an online massive multiplayer world. And it ultimately saved my life, but it also led me to be failing my classes and distracted me and brought me into this other reality. Eventually, I was able to come out of the closet to my clan in the virtual world because of the anonymity in that environment. And then I came out in the real world, and that experience led me to think, what if we could use the virtual world to actually build something that helps people, that enables them to come back to reality more empowered than they left it? And so I pursued a PhD in clinical psychology at Vanderbilt University. where I studied under Steve Holland, who's a protege of Aaron Beck, who actually was at Penn. And he, he developed CBT, kind of the development of CBT, and he's my academic grandfather. But as I did this, I also realized that therapy is inaccessible for so many people. And so that launched us on a journey, because as I started to do therapy with patients and develop my clinical hours, I realized people can't get help. Half of people who need it can't get help. And it's a huge problem in the world. It's costing over $2.5 trillion a year. And the power of peer support is so great. So peers can deliver cognitive behavioral intervention. The whole point of CBT and DBT and these different types of interventions is that these are tools that we can learn and that we can teach a patient. And so it's not that far of a step. And in fact, data shows that people can teach each other these tools. We also know that social support is a really key component to boosting computerized CBT. So even if you have a completely automated intervention, adding in social support boosts the efficacy of that intervention. And then lastly, one of the most important data points is that what we call nonspecific effects accounts for the majority of outcomes in therapy. So nonspecific effects are kind of these building a warm relationship with your therapist and having that empathetic place to go accounts for over half of outcomes of therapy. And so peer support can amplify those nonspecific effects, which is what Jules has been doing over the past 20 years. And so I decided to start Innerworld with Jewel, and we have funding from a lot of different institutions. We're funded through venture capital and also through university, and we also have funding from NIH and NSF. And essentially, Innerworld is a place where people can teach each other the tools of CBT. And so we call this cognitive behavioral immersion. And actually, Dr. Beck, before he passed away, I visited him in Rittenhouse Square, and he got to try Innerworld, and he thought that, this is the future. So it's really cool to be back at Penn actually talking about this right now, and he was just an incredibly brilliant person. And so Innerworld works across virtual reality and also flat screen devices. So it's really exciting that there's 20 million headsets, Oculus Quest 2s out there right now, but there's 6.4 billion smartphones as well. And to truly make something that's scalable that everybody can access, regardless of how much money that they have, Jewel and I are very passionate about making sure that this is accessible on any device. And so before I present some data on Innerworld, I just want to kind of give a visual of what it looks like. So basically, people come into Innerworld as avatars. They can make an anonymous avatar with an anonymous username, and they go to live scheduled events that are led by trained guides. So we train our peers in how to teach these evidence-based skills in this kind of group setting. The number next to each person's name tag is how many months since they've been in the platform. And we have these three-dimensional tools that can be presented in the spatial environment. So we have that element of comfort and anonymity where people can really open up and share more, whereas virtual reality is the most interpersonal and anonymous technology that exists. You can simultaneously feel like you're with other people, and you can also be anonymous with a username and an avatar. So we wanted to study how is Innerworld affecting people. So we basically did a single-arm trial where we tracked depression and anxiety outcomes in individuals who were using Innerworld. And we had some interesting results. So first, over 10 sessions, there were significant decreases in PHQ9 and GAD7 scores. We ran an ANOVA, repeated measures of ANOVA to compare the first and 10th session and saw a significant decrease. And then we also saw that more social support was correlated with greater symptom improvement in depression, which is not that surprising, but it's really interesting. We measured social support through self-report measures of a 30-item questionnaire about how connected people felt in the community. And we saw that the more support people are feeling, they're also reporting that their symptoms are going down. They're feeling less depressed. And also, in addition to this, we also saw that we looked at the magnitude of symptom change between people who were using virtual reality devices and people who were using the flat screen devices. I do want to say that this is not a randomized controlled trial, which is what's necessary to have a causal implication. So this is just an interesting result. It's not a result that proves anything necessarily. But if you see on the left, you can see the virtual reality magnitude of change. So the light blue is depression symptoms and the purple is anxiety symptoms. So you see like a 4-point decrease or about a 3.5 decrease in symptoms on the PHQ9 and GAD7, whereas with the flat screen, you're seeing a much smaller magnitude of decrease. And so this is really interesting to us, and we definitely want to explore randomizing people to the flat screen condition or the immersive VR condition to really understand what is that differential impact that the immersive virtual reality is having on people. In addition to the data, we also have experiences from members. I think Tim Beck, when he developed CBT, Marshall Linehan with DBT, all the different types of interventions, a lot of them that have been developed, started from a qualitative understanding of the problem and what people were experiencing. And from the qualitative data is where we can draw hypotheses. So we're going to play this video talking about their different experiences. And then we'd like to spend the rest of the time, Jewel and I, answering questions that you might have about this.
I'm a person that I live alone. I don't have a partner. I don't have kids.
I've been on the road to recovery for quite some time now.
Being bipolar, ADHD, and anxiety.
I have really bad anxiety.
Autistic, ADHD, anxiety, social anxiety, mobility issues, heart and lung disease. I have all those diagnoses.
I joined Innerworld last week, and my biggest struggle is that I have not left the house alone in 6 years. And just in the past several days attending meetings, I actually had the courage today, thanks to the support that I received from this group. I left the house by myself for the first time today in 6 years.
Having been a 13-year combat veteran, having some struggles of my own, it's hard to relate with people in the civilian sector, and mental health is a crisis throughout our veterans. The VA struggles to maintain a mental health platform that can help everyone in its system. When I came here to Innerworld, everybody's very friendly, very accepting, very non-judgmental, and I found a good place for me to share my experiences. Becoming part of a family is what veterans like, and that's what they're looking for, and I think they would definitely enjoy this platform if they knew about it some more.
So I'm a stay-at-home mom of 5 very young kids. The past couple years have been really tumultuous, and they were really traumatic, involving a really complex and high-risk twin pregnancy. I found myself drowning in postpartum depression and anxiety constantly. I started feeling downright desperate, and honestly, I was feeling really hopeless, like I had nowhere to go. It was like 1 minute I was alone on a deserted island of hopelessness, and before I knew it, my island stretched out into a peninsula of people that were standing there with welcoming arms wide open. I don't know how else to explain how I ended up here, besides it being a literal divine intervention for me.
I don't currently own a VR headset. I went through a really bad breakup last weekend. I moved across the US to be with the person I was with. I don't know anyone here. I decided I was going to download it and see what it was about. I attended my first meeting that night, and just that one meeting made me feel so much better. Just being able to talk to the people here, hearing everyone else's stories, it's really changed and helped me a lot, even though I'm still going through a lot of emotion. It's really helped having this place to come to.
I grew up in an abusive home, and I left home at 16 as a high school dropout and got married and learned how to survive. And the whole time when I was younger, I was alone most of my life. I kind of had to fend for myself and figure things out. Eventually got involved in behavioral health. I've been in it for about 17 years. And my oldest daughter, who had autism, committed suicide 8 years ago. The thing is, the people that are giving those support end up the ones that don't have a support system in the end. And so when I came here, I felt supported for one of the first times in my life.
You can see how it's like a transdiagnostic platform where there's people with all sorts of different experiences that are coming in and having these transformative experiences because of the power of that anonymity, where they're more comfortable sharing and opening up. And it's a really powerful way to track clinical outcomes as well, because we have self-report data, you have voice data, movement data. There's a lot of data that you can use to do things like digital phenotyping and detecting changes and symptoms, and then also personalizing the intervention as well. So yeah, that's Innerworld, and we'd love to answer any questions that you guys might have. Yeah. So the question was, are people leading these groups? So I don't know, Jewel, if you want to describe kind of the facilitators and how we how we approach that as well.
Yeah, we've developed a system to be able to train guides. There is a live guide 24 hours a day, 7 days a week, which I think is an incredibly helpful, useful, and needed thing. When you come in, I'll just sort of describe the experience. You come into a private space, and then you can choose to enter a public space where there's always a live guide. You can also see calendars of daily sessions. We have hundreds of different programs on everything from how to handle grief to dealing with anxiety, et cetera, et cetera. We are just starting a program for 18 and under. I want to say it's 13 to 18. Noah can correct me. And we can very easily, I heard you mention that with your work, it can be really stressful. And we can white label and create specific peer groups for people that are under really specific pressures. So right now we're starting to work and look at working with firemen and first responders so that we can meet their mental health needs and give them support.
Yeah, and the facilitators are also, they go through a rigorous evaluation process as well. So, that's a key part of what we're doing, but we truly do believe the only way that you can scale mental health intervention, especially those non-specific effects with empathy and warmth, is through getting this other workforce of people who can come in and be providers, because there's just not enough therapists for the global mental health demand. So, yeah, sure.
Children, they're digital natives and they play Pokemon, and then they're in some kind of other video game, so this will be very natural for them. But I also worry about are they screened before they go into a space? How are you ensuring no harm is done? I've been in alt space and I wandered into a grief room, which I didn't belong there, but I just wandered in because there was no door and it was my first time there. So how do you screen whomever is admitted? And then related to that, we find the challenge of digital front doors for mental health in our healthcare system. How are we making sure if somebody has like a suicidal ideation in that session, how do you intervene? Have you had to face that? Easy questions.
Yeah, safety was really important to us. That's why we did 4 years of beta testing to make sure that we could deliver a really safe environment. And it's done through a multitude of ways. One is we are able to monitor using AI, and we are able to make sure that everybody's safe. We're able to know where people are. There's no trolling, it's a troll-free space. And Noah actually developed a lot of the proprietary technology around it. So you can definitely answer that better than me, Noah.
Yeah, I think what you mentioned is really important, and our ability to use technology, and then also the onboarding experience. I saw another question through the app about what differentiates this from like VR chat or alt space. We've built it from the ground up for mental health. Like, we spent a long time thinking about, do you show the whites of the eyes of the avatar because people have social anxiety, and do you have eye contact because that can also lead to more anxiety? Is it better or worse? There's so many different things to experiment with and test and collect data on. But for trolls, we've really made it very difficult for trolls to have a presence. We also have a 24/7 team, like Jewel mentioned, that is able to respond to incidents. And then the last thing I'll mention is that just like with any clinic, when someone's coming into a clinic to get evaluation, as a therapist, I'm trained to tell them about confidentiality and different kinds of disclosure and things like that. So here, there's a pop-up that says, do you understand this is not therapy? And if they say no, they can't come to any of the events. Also, do you understand that you could be identified, through your voice? And lastly, that it's not crisis intervention. So we have a whole plan around we have crisis resources that we present to people, but we don't actually do the crisis intervention currently. Although I think that's a future direction that we're definitely interested in, because people in crisis are going to continue to come into these environments as well. So it's a much safer, more regulated space than these other applications. So parental consent. So we did a lot of research on this. Things like 7 Cups of Tea and other kinds of platforms, they get parental consent through the terms of service. It's buried in the terms of service, and they have the child click the box that I agree in order to use these services. But we're taking a much we, again, want to be as ethical as possible. So we have a pop-up that says, like, do you have consent from a parent or guardian? Obviously, an important element, and Jewel can speak to this more, that you've seen in your foundation, but there are some kids who don't have a safe parent or guardian. So we want to provide that space for them as well. Great.
Hi, when I was at Walt Disney Imagineering, I led the project Virtual Magic Kingdom. And after about 4 months, when we got about 5 million, primarily kids, but players in the world, some of the feedback we got from families was they were feeling so much more comfortable in the virtual world than they were in the real world, that we ended up having to dial back the number of hours of the day that the world was open. Have you found, and you know, we did that because they needed to do homework and be in life and eat food and go outside and play. Have you run into any of those kinds of challenges where the world becomes so much more comfortable than the other world that it's impeding their lives?
Yeah, I think something we were very sensitive to was making sure that this wasn't an unhealthy escape, right? We're here to help people feel better and to help them, more importantly, give them tools for their real life. So we don't look at this as escaping into a stress-free place. We look at this in a place where you can get neurological relief, your nervous system can relax, and you can learn tools that help you make your life better. And we're seeing the results of that. We have multiple testimonials, and I'm sure you heard them, where people are actually finally leaving their homes for the first time after being 4 years of not leaving their home. People's personal lives are improving. They're able to engage in their personal lives better, and we're able to track that. Also, if somebody is in Innerworld a lot, we can tell. And so we get alerted as moderators so that we can intervene and then go see what's going on for that person.
Exactly. And you think about it, do we want people who are, you know, problematic users or having it as a habit, do we want them escaping into a place that's designed to get them to play more and more like I did as an adolescent in RuneScape? Or do we want to be able to meet someone where they're at and be able to say, hey, I was noticing that you're logged in a long time. So this is the place I wish existed as a teenager. And I know, Jewel, you also wish that you'd had this kind of peer support with these tools as a teenager. So I think that's where we really see the power here.
No, I'm interested to know what is the connection to the CBT, to cognitive behavioral therapy. You know, really in the standard therapeutic intervention, it's a therapist pointing out the discrepancy between the patient's perception of their situation or their thought, which in essence may be considered inaccurate, and it's that relationship to point that out. Clearly, this is at least on the surface to me, I'm interested to hear the answer. It seems like a more passive hit or miss proposition. I understand the support component and how that's can add to a feeling of safety and so forth. But how do you reconcile connecting this world to CBT without kind of an active intervention?
Yeah, what we're finding in Innerworld is we're able to give very personalized care. People know their pain points, and typically they'll come in with a very specific pain point. For instance, my dog just died, and I'm in a lot of acute agony. And so the guide can pull up, would you like to see the grief cycle? Have you ever seen that? And so we can pull up and spawn a visual aid of what the grief cycle looks like, and then say, would you like to attend a group meeting about grief? And then in that meeting, it's specifically around the tools, the CBT tools that are around grief. And so there is that guide one-on-one where you talk through, this is how I was perceiving it. What are the other ways of perceiving it? The guide is trained to do that, as well as the group really helps, because what I've learned over 21 years is when the group and you hear other people's problems, other people's perspectives, and where they are trapped in their own thoughts, it really helps and benefits everybody.
Yeah, and we also have the three-dimensional tools. We have, for example, the fear form, best case, worst case, best case, most likely. That unlocked that person who couldn't leave her house alone for 6 years in just a few days. She learned that tool. But she also learned that tool in a group with other people who were also talking about their agoraphobia and issues that they were struggling with. So it's combining those structured tools of CBT, but instead of sitting, and it's not a replacement for therapy. We think therapy is always going to have an important part, but it's a very different experience than sitting across from a therapist who's supposed to be collaborative, but there's a lot of therapists out there who aren't bringing in the tools. They're just doing supportive therapy and kind of talking on like these BetterHelp or Talkspace, platforms and things. So we really have the tools as a central focus in addition to the support. So we can combine both of those and kind of potentially maximize the effect, although we need an RCT to know. So.
This is fascinating, Noah and Jewel. So first of all, congratulations. It's really a nice, different take to empower the patients. Being a founder of another mental health VR startup, I'm curious, how are you looking at HIPAA? How are you looking at digital therapeutics? Because here it's so complicated when you have, unlicensed patients providing that intervention.
Yep.
How are you doing quality control, for instance?
I'm very glad you asked about digital therapeutics because some people here have heard my take on that, but so much on a sec. But also in terms of quality control, we have outcomes, we have surveys, we have natural language processing that we're able to conduct to make sure that the quality is high. And then also we aren't making any claims about treatment. We're seeing symptom reduction, but we're not making any claims about treatment or intervention because we don't want to operate within a healthcare system that has very big flaws that people can't access. And that's where digital therapeutics comes in. Companies can make a lot of money. I was on the advisory council for one of the first digital therapeutics. But when we charge $4,000 a month for an app where you're reading modules about CBT, because it's effective, we need the outcome data, you're requiring someone to go to a physician, get a prescription, and then they can access the app. That's completely backwards to what the potential of technology is. We can scale mental health intervention. We can have every single person who needs help be able to get it without having to go into a provider. And not only that, but then we can get people to go into providers if they need that higher level of care, and they can bring a bunch of data with them. Imagine if every patient that therapist saw had 10 months of PHQ9 and GAD7 data that they could look at trajectories and things like that. So that's where we're trying to push the field instead of requiring people to get prescribed a digital virtual reality app, because that's going to reach a fraction of the people, and it's really restricting the potential of the technology.
Two questions here. So first question, your study that you guys were talking about early on, is that published research that can be cited and found somewhere?
It is in submission right now. So one of the studies is in submission to someone who's in the audience right now, but they're not involved in the review. But yeah, we have 2 articles in submission right now. So,
Cool.
Yeah.
Super cool. All right, second question. How are you guys deploying or finding success outside of just like the general VR consumer market, where you mentioned firefighters and stuff? Like where are you bringing Innerworld to, and how's that hitting?
Sure, Jewel, you're our chief strategy officer and have already made a huge impact. So yeah, let you speak to that.
Yeah, I had a business where I worked with companies as a consultant to bring mental health tools into the workplace. And through that, I just developed a lot of relationships in the world, from first responders to just CEOs who are realizing that they have to address the mental health needs of their companies. And so our strategy is to make sure this is available to everybody. And because it's so low friction to be able to provide and personalize care for different groups, that's really one of the routes that we're pursuing. A lot of these communities are underserved. We know that our first responders are underserved. We know it's difficult to get time off to go into providers. And while we certainly hope they keep seeking therapy and have access to those things, we believe Innerworld is a really beneficial solution that's very low friction. They can do it at the firehouse because they have their VR goggles, or they can just do it off of their laptop in a quiet space. Same for business. We believe B2B strategy is going to be really important to our growth because, again, employers are looking for solutions that are meaningful.
Yeah, and I think we do have to wrap up, and I just want to mention one last interesting anecdote that we've had, a phenomenon where people are coming into Innerworld in VR with agoraphobia and other kinds of things, and then they're taking Innerworld on their iPhone with them when they're going out and doing their first exposure experience. They're going and bringing, and they're logging in, and people are like, you can do this, you can do this. So it's like this live group peer support during an exposure paradigm. So the potential for the technology can go in so many different ways that, yeah, Jewel and I are very excited to grow this and also to build a robust clinical research platform, because there's a lot of really interesting research questions, including we have a 3-arm RCT that we submitted to NIMH to randomize people to the flat screen versus the immersive versus control, so that we can really start to see the differential benefit or lack thereof of the immersive technology. So yeah, thank you everyone for your time.